Good evening and welcome to Doctors on Call. I'm Dr. Mary Owen, Associate Dean of Native American Health and Director of the Center for American Indian and Minority Health at the University of Minnesota Medical School. I'm also a family physician for the Fond du Lac Band. I'm your host for our episode tonight on Indigenous Health. The success of this program is very dependent on you, the viewer, so please call in your questions or send them into our email address, ask@pbsnorth.org. Our panelists this evening include Dr. Arnie Vigno from the Fond du Lac Band of Lake Superior, Chippewa, Minnesota, Minoyuan Clinic, and Mr. Ricky Defoe, also from the Fond du Lac Band of Lake Superior, Chippewa, Minoyuan Clinic. Sorry about that. Our medical students answering the phones tonight are Stephanie Kiefer from Puyallup, Washington, Andrew Tischer from Wheaton, Minnesota, and Ava Hill from Aurora, Minnesota. And now on to tonight's program on Indigenous Health. Thanks for being here, you two. This is National Native Heritage Month, as you both know, and we get a lot of asks to do shows on this month, but I still think it's great that the show is doing Indigenous Health, and I'm so happy that you both joined me. I'm going to give you Ricky for joining me tonight, and Dr. Vigno for joining me tonight. Giving tobacco is not something that we do in my tribe, but it's something prominent here. And so I've learned to do, when I ask someone to do something or join me on a show like this or to help with teaching the students, I give tobacco. What's the purpose of that here?
Well, I think tobacco is custom, part of the culture. No, commercial tobacco is the problem. So we want to be connected to the bark of the Anishinaabe trees, the beans that are in the woods, the plant nation. So we want to have that connection, and that's our ultimate goal. But to be partaking in the custom of asking someone with something that's so important, even if it is commercial tobacco, is a step in the right direction. So we got a ways to go, but we're practicing something that has been needed amongst our people for healing purposes for quite a while. So I've accepted this tobacco in a good way, and I thank you for that moment.
By the way, I gave you the good stuff, Dr. Vigno. You got the commercial stuff. So.
I can still deal with that.
Okay.
So I carry the traditional stuff in my pocket, and I make it in the winter, and there's a certain time of year that you make it, and apakozagun is what I use. And as a physician, I'm a scientist, and when I went to medical school all those years ago, decades ago, I kind of thought that medical school would science my traditions right out of me, and that I would know the biochemistry of things so much that spiritual things and traditional things and belief systems would just get scienced right out of me, and it didn't, and it's stronger. And I've known Ricky I've been on Fond du Lac for 28 years, so probably 28 years, and learned much from him, and we learn from each other. And giving tobacco is when you give somebody tobacco, you give it to honor them and to make that moment between the two of you clear, so you can ask and receive.
What does that have to do with health, in your mind?
In my mind, traditions and ceremonies were illegal for the longest time. It was 1978 when the Religious Freedoms Act made ceremonies legal again. But before that, they were illegal. And people got moved to cities. There's boarding schools. There's a lot of things that have happened in the past. Boarding schools took a couple generations of parents away from kids, and making our ceremonies illegal made things hard. And there was relocation programs where people would be moved from the reservation into the cities with the promise of well-paying jobs, and those jobs didn't necessarily surface. My grandparents went to Minneapolis based on that, and and then they couldn't harvest traditional tobacco the way they always did. So they used commercial tobacco and used it for ceremonies. But it's so addicting that that people started using it casually, and it's a powerful medicine. And if it gets used the way you just used this, it's a good medicine. But if people use it casually, then it causes cancers and COPD and emphysema and all the other stuff that comes with it.
Ricky, anything to add to that on the health benefits of offering the tobacco, this tradition that's rich here among the Ojibwe, not among my own tribe, and we're all different. That's the point I'm making.
I think there's excuse me. I think there's huge benefit to reestablishing connection. Too often in today's world, technological world, you have texting and emails and phone calls and things like that. That's impersonal. When you make a connection with something that is, in our world, is as movement, spiritual movement, you reestablish that connection, and there follows wellness, real personal relationship with each other, with spiritual, because I think the elders have said to be whole, you've got to include the unseen. So when we see some things moving in, with one another in the spiritual realm, I think that's where healing takes place. So it's reconnection, and it's being authentic to oneself, your spirit, and, as Anishinaabe. So it's a good thing to practice.
It's also one of the many ways that we as Native people in general, in my own tribe we do it differently, but practice reciprocity. And one way of watching out for one another, which of course is part of our health care too, right? Taking care of the community. Mm-hmm. So we do have a question. First of all, tell Arnie hi from Ben. And then the question is, can you elaborate on historical trauma and its impact on Indigenous peoples? Do you want to take that one?
Well, I talked about boarding schools a little bit, and that was a couple generations of lost teachings and lost traditions. And my grandfather was in boarding school, and he was fluent Ojibwe, but he wouldn't speak it. He would, if we asked him, what is the Northern Lights? What is what's the name for a deer? He would tell us that, but he wouldn't speak it because he thought if we were fluent, the same thing that happened to him would happen to us. And with that loss of tradition and loss of culture, and tobacco abuse and all the other things, and poverty that followed, and loss of land and traditions, and not being able to wild rice and do maple syrup the way that they always did, when they were in the cities. Then other things filled that void, and it ended up with things like PTSD and depression and domestic violence and alcohol use and a whole host of other ills.
Do you want to add anything to that?
Can you clarify that question again, please?
They're asking about, can you elaborate on historical trauma and its importance to Indigenous people, its importance to Indigenous people, particularly our health?
Historical trauma, I think, is important to know the past, because you say if you don't know the past and you're in the present, it'll just keep repeating itself. So to be able to heal the ones that are yet to come, those are some things that you need to know. A lot of things are hurtful. There's a soul wound in America, how it started, and the treatment of our ancestors, Indigenous peoples particularly. So those things are very hurtful. Lots of the young ones will say some stuff like, we don't want to hear about all that hardships and things again. We want to talk about the good things and stuff. Well, to get to the good things, you've got to go through some hard times and rough times, because there's a balance there. And really it's out of balance, and the injustices, social injustices, and every injustice against. So we have to kind of balance that. How do we do that? By multiplying those healing moments in our life with each other, with our children and things. So we have those benevolent moments rather than those reflecting and wasting energy on. We're not wasting the energy, but we're really, we have to find balance in the use of our energy. We don't want to focus on trauma particularly, but we have to be trauma informed. And we just cannot write off what happened to our parents and our grandparents, our great grandparents and things. I'm a graduate of Philander Indian Boarding School in 1976. These are eras and times in our life, chapters in our life and things, and we move forward, whether it's with trauma, whether it's with grief or not, we move forward with that. So it's a part of who we are. So we'll take that along with all the other moments in our history.
And I think the other important part of that is that as healthcare providers, we have to recognize that sometimes when patients are acting in a certain way or doing certain things, we have to always recognize that there oftentimes are other things that are going on for a patient that we might not know anything about. And it could be related to some of this history in the background and what their families have all been through. And take that into account. I want to change tack a little bit. All three of us work for the Fond du Lac Nation, Fond du Lac people. And we work for the tribal clinic. I work in the one downtown, and you two work on the one on the reservation out at Cloquet. And but I don't think that everybody understands about our health care. People don't understand that it's not free health care, that it was we received health care as part of the trust responsibility in this country for all the lands that were given up in treaties. And our clinic, the Fond du Lac Clinic, like my own clinic at home, is tribally run versus IHS run. And people don't understand that when Native people get health care, and only 60% of them use the IHS, but the IHS is the Indian Healthcare Direct Services, like at Red Lake or White Earth, tribally run, which is what Fond du Lac is, or urban Indian Health, which like in Minneapolis, there's the Minneapolis Indian Health. So, but Fond du Lac again is tribally run. And it has been since did you say 1968, or we're not quite sure? No, because 1975 was the passing of the Indian Self-Determination Education Assistance Act that allowed for us to start running our own programs. But I'm not quite sure when Fond du Lac went from IHS to tribally run. But it is tribally run now, and what do you think are some of the benefits of us running our own programs, us running our own health care?
Well, we know our own issues. And, so we get to determine, how to take care of those things, using traditional healers and traditional medicine and being able to access that, and being able to refer somebody to Ricky if we need to, or to the cultural center in general. And, to let people know that going to ceremonies isn't something they need to hide from us, that that's an important part of their health care. And people should access all of that, and they should be able to do the things that have always been medicine for us. And this tobacco that you gave us is medicine. And as a scientist, it seems, and everybody that goes to medical school is, by virtue of what they have to do to get in there, is a scientist. And but the science part of me wouldn't have believed that tobacco was so important, but it is. And to be able to use that freely in talking with patients, and Ricky did a ceremony for all of the medical providers and the nurses, different ceremonies. There's too many of us at one time. But so, the people that work for the clinic could see why they're doing what they're doing. why it's important to. And Minaja Idowin is the word for respect. And, we respect our patients, and we respect each other, and we respect the traditional people in the community. And, being able to do that as part of a medical practice is important.
Thank you. Ricky, why do you think it's so important that we be able to send our patients over to you for traditional healing?
Well, I think it's important because the people have skin in the game. The Indian Self-Determination and Education Assistance Act of 1975, it was an empowering piece. And it's really reinforces tribal sovereignty, things that we've been pushing for quite some time, to be recognized in that fashion, that we're beyond just what stereotypes are attributed to us as a people. So we have skin in the game. We make sure that our health and wellness is tied up in the health and wellness of our family, our community, and the nation as a whole. So it's not just a job; it's a way of life, and it really, there's so many different dynamics and dimensions of health and wellness. So each part is a critical piece. So I think that, also known as Public Law 638, is a piece of self-determination. So our skin in the game is all about health and wellness for those children that are yet to be born, the grandchildren, the great-grandchildren. So we have the 7 generations connected. I think we welcome that, and any of those threats that are against that, we will continue to resist. And when it comes to our health and wellness.
Sometimes when I am teaching with the students, I remind them that we are making up for 500 years, or since arrival of Europeans. Those health disparities have been here that long, and it's only been 50 years since we've been running the show ourselves. Since 1975, we're celebrating the anniversary of ISDIA now. So we've only really been able, 50 years is not a long time to be able to pick ourselves up and start to repair all the damage that was done. But the other thing that when we run our clinics ourselves, we offer different things. We're much more, we're able to offer different services, like we go out and pick up our patients. Or again, we refer people over to you, Ricky, for traditional health services that we might not be able to if it were simply IHS run or a private clinic. So, and you are starting to learn more traditional medicine yourself, aren't you, Dr. Vigneault?
I don't do traditional medicines as much as want to learn the language, and the language when with boarding schools and programs designed to take away tradition and take away language. Our elders were wise enough to hide our lessons in the language itself. And there are words that Ricky teaches Ojibwe language, and sometimes in the course of it's not just learning a word; it's learning the reason behind it and stories behind it. And sometimes things take off on a tangent, and I like those tangents. I learn a lot from those things, and.
Why do you think learning language is important to the healthcare of, learning the Ojibwe language is important to the healthcare of the people you're taking care of, the Ojibwe people?
Because when Ojibwe people were the only people here, they had trade routes, and Duluth was a major trading port, even for for native tribes. But they had a culture that worked for them and took care of everyone and respected elders. Gitchi Aya is a great being, is the word for an elder. And a lot of that has gone by the wayside, not for us so much, but for the world in general, where when somebody gets old enough so they're not able to make money, they're not as useful as they used to be. And for us, they're as useful as ever, even more so. They carry the knowledge and the wisdom and the memories that we need to be better as a community and as a people.
Thank you for that. I have so many questions I want to ask both of you, but we better be respectful to these questions here. Dr. Vaino, this one I want to ask you here. How do you incorporate traditional medicine into a patient's care when Western medicine might be more effective? Example, type 1 diabetes, uncontrolled type 2 diabetes, heart failure, etc. Risk versus benefits.
That's a thing that kind of flows back and forth. I don't want to make it seem like, I'm only trying to do traditional medicine because I am a scientist. I'm a physician. I went to medical school. I went to residency, and and we use up-to-date, and we use AI if we need to, and we do x-rays, and I read x-rays, and I read EKGs and interpret labs, and all of that stuff. I'm veering off from the question here.
That's okay. They just wanted to know, I think there's a presumption in the question, at least if they wrote it exactly the way the person asked. How do you incorporate traditional medicine into a patient's care when Western medicine might be more effective? So I think there's a presumption that it's one or the other, and so I think you were hitting it.
Yeah, it isn't one or the other, it's both,
Right.
and it's fluid.
Exactly.
And it can flow back and forth. And I give people tobacco in clinic sometimes. If I'm having someone that's really having difficulty with just life in general, and loss that's too big and tragic. Somebody whose son was killed tragically in an accident, but it's not the right order of things. And he couldn't go on. And I gave him tobacco in the clinic, and I had him put tobacco out every morning for 30 days and come back and see me. And every morning when he did that at sunrise, he lost a little bit of his grief, and he'll never lose all of it. And but when I saw him back, he was so much calmer. His blood pressure was better, and he had that time for himself, just to put tobacco out in the morning and be thankful for the things he still had, and thankful for the time he had with his son. And it didn't bring him back. It didn't take away all of his grief. But it was the biggest thing I could have done for him.
Thank you. And we all experience that as healthcare providers. Each one of us has experienced that. But there's also research that shows it, that traditional medicine benefits our patients, that suicide rates go down, diabetes rates get better with traditional medicine. So thank you for that. There's a quick question. Are these clinics just for Native American individuals, or do they provide care to non-Native people as well? One of the benefits of our tribes running themselves is we have a little bit more say-so on who gets to come to the clinics. Traditionally in IHS, it's if you're tribally enrolled, but our clinics, like Fond du Lac, gets to make more decisions on that, and they generally will serve mainly Native patients, but I know that they also see some spouses. It's important to remember, though, that our healthcare is so, despite the fact that healthcare was promised to us, it is so significantly underfunded every single year at the Indian Health Service. Paltry. We should be funded about $70 billion, but each year we receive only around 7 to 10 million, or 9 billion at most. So we have to do well with what we can, and that's why traditional medicine, incorporating that, has been so important, because it's probably the most powerful tool we have. And I'm talking too much, so let me get back to you guys.
And we bill insurance.
Yes, we do bill insurance, yep. And in fact, we're also able to, just because of Medicaid now, bill for even some traditional medicine in at least 5 different states. It's a project right now, a pilot project for Medicaid. Dr. Ricky, if we can try to squeeze this one in, what can outsiders do to help lessen the generational stress and historical trauma experienced by Native communities?
Well, education is the key. We've been educating non-Native folks for generations, and many have been friends of the so-called Indian and become allies and things. The challenge is to have non-Native folks teach other non-Native folks the things that happen within our community, because as we age and teaching gets more and more challenging, we need the young ones to step up, of course. But it's respect is the key for any community. You have to have the respect for one another, back and forth, reciprocal, and you always give the respect. If that other individual don't give it back to you, that's their problem, not yours. So we give the respect, and we look to be accountable to your ethical teachings, your spiritual teachings, your principles you live by, and the discipline that you're taught by your elders. So how to follow those things. So that's what we're accountable to. I think empathy is the biggest piece about community, where that's a starting point for the healing that takes place. So in a nation that lacks empathy, like in the United States, we then we're looking to foster that empathy. Thank you.
Thank you so much. I wish that we had more time. We could go on forever, I think, here. I want to thank our panelists, Ricky Defoe and Dr. Arnie Vigno. Please join Doctors on Call next week, where Dr. Krista Coide is joined by regional experts for a panel discussion about diabetes and other endocrine disorders, with a panel of experts from around the region. Thank you for watching and joining us for season 44 of Doctors on Call. Good night.